Yeah. Hi, this is Dr. Prashant from Medical. As you will know, I lay a great emphasis on clarity of communication and for my patients to know exactly what they can anticipate when they are choosing any kind of treatment with us. So we have quite a few liposuction patients lined up in the near future. It is one of the commonest surgeries we do over here. We do it under tumescent anesthetic, which means you're completely awake, a little sedated with an oral anxiolytic pill, but you are awake throughout. It is the safest way of doing liposuction. So I thought it would be a good idea to go over the consent form for a specific kind of liposuction we do. We are one of the only clinics in Wales which has this facility. It is called BodyTite or neck-tight associated or assisted liposuction. And this is a fantastic treatment because it combines the power of tumescent liposuction while also enhancing the tightening of the skin envelope after liposuction by anywhere between 30 and 40% more. So I'm going to go, all my patients get the information pack, which has got an introduction to the procedure, a consent form, a pre and after care form, and also a shopping list of things they need to have in stock at home to prepare for the surgery. So today I'm going to go over the radiofrequency consent form. All my consent forms have got the same kind of structure. So there is a section on consent instruction which makes it clear that while the majority of cosmetic surgery patients have got a fantastic result and are very happy with the procedure, there are always going to be some patients who are not going to be happy with the procedure or the results we get out of it. So you have to know what you're getting yourself into, and we have got complete clarity. We do not hide anything in terms of the risks and the complications that can be anticipated with these procedures. So do read the consent form in great detail. Underline anything that you need to ask me about, and make sure you've understood the other parts of the information pack, the pre-care and the shopping list. Remember that you have a legal right to say no to the surgery, even on the day of surgery, even on the table, because it's completely reasonable for you to say no at any point in time. Clearly, there will be an admin fee that will have to be deducted if you are doing it at a very short notice, but it is your right and you have the full authority to say no if you don't want the procedure. The next section in the consent form is a general information, and it tells you about what radiofrequency assisted liposuction is all about, how it enhances the collagen tightening and the fat remodeling, and it also tells you about the reality that aging, hormonal changes, weight loss, weight gain, all of these can influence the outcome of the surgery. In most patients, the treatment results are apparent at about 3 months, but it can vary from patient to patient, and I would generally advise patients that you have to wait about 6 months to a year for the final result to start showing through. We also discuss the alternative forms which you could consider of treating the condition. Say for instance, when you're considering liposuction, it could be wearing special body shaping garments. It could be non-surgical treatments such as Morpheus 8. We do have that. Cool sculpting. I personally I'm not a fan of cool sculpting. You can diet, and of course you should be on a healthy diet and exercise program. All of these treatments like Morpheus, the cool sculpting, will have their own set of side effects which you have to be aware of. The surgical alternatives could be laser. I have used laser in the past and don't really fancy it as any add-on. There are some advantages, but for the majority of patients, the BodyTite associated or neck-tite associated liposuction is a far superior treatment. In my opinion, you could have water jet assisted liposuction, you could have laser assisted liposuction, you could have autologous fat transfer if that's needed. So there are surgical alternatives to BodyTite or neck-tite associated liposuction, but all of these come with their own set of risks and complications. Then we move on to the specific risk of radiofrequency assisted liposuction. So all the consent forms have got risks that are specific to a treatment and risks that are common to all surgical procedures. In this video, I will just restrict myself to the risks that are specific to radiofrequency assisted liposuctions. And these are that we use tumescent solution to get the anesthetic effect, and this has got a combination of various things, commonly lignocaine, adrenaline, and we sometimes use tranexamic acid in it. So patients could have allergic reactions to any of these molecules. We do kind of clarify your past exposure to lignocaine and adrenaline to make sure that you are a safe person to have the tumescent anesthetic. Now, but allergies or the problems with interactions of your metabolism and body to these solutions is always a risk you have to undertake. And the other one is lignocaine toxicity. Now, we use far more lignocaine to anesthetize that area than your dentist would, for instance. But this is a very specific use of lignocaine in tumescent anesthetic. It's been well researched, well documented, and is extremely safe. The dose that we use are 35 milligrams per kilogram body weight, and this is approved by the American Association of Cosmetic Surgeons. So we do not exceed the dose to stay on the safer side. There are symptoms of lignocaine toxicity like lightheadedness, ringing sound in the ear, strong metallic taste, slurring of speech, numbness of the lips or tongues, excessive shivering, muscle twitching. If these happen, do get in touch with us immediately. You will have my mobile number with you, and also get in touch with the A&E if you can't get hold of us. Patient selection is another risk. If you have a poor skin tone, you will have limited results. Liposuction is not a procedure for weight loss, so obesity is not really treated with liposuction. We generally try to encourage patients to be closer to 25 BMI. We generally will not operate on patients above 30 BMI. So that is one risk. And the other thing in patient selection is patients with unrealistic expectations. Do discuss your expectations with me. You can get role pictures of people who you think you want to have a contour like. We have to remind you that you are your own person and that we cannot replicate and create a body shape of a movie star if that is not possible for your body type. So selection of patients is important. You also have to remember that there is a limitation of how much fat we can set out at one time. With your safety in mind, we will not go above 5 liters of fat taken out in one session from multiple areas. So that is a well-established, safe recommendation. You can get skin laxity, so sometimes the fat is holding out the skin, and taking the fat out will cause laxity of the skin, and this is essentially why we do the BodyTite liposuction, to try to tighten the skin. Skin sensitivity after the procedure. You can have numbness, you can have tenderness, you can have exaggerated kind of tingly sensations. All of these go with the fullness of times. Radiofrequency assisted liposuction, like neck-tite or BodyTite, uses heat, so there is a chance of you getting burns, but these devices have been manufactured with extremely robust safety precautions which reduce the chances of burns, and I have not seen a burn in my practice. Cannula fragmentation is a theoretical risk where the tip of the cannula can break. It is extremely rare. Chest complications, as with all liposuction procedures, this is a blind procedure. The seeing hand is the left hand, and I'm feeling for the depth, and theoretically you can go deeper than what you want. So in the chest area, you can go into the chest or in the tummy. Now this is where tumescent liposuction comes in its own, because if a patient is completely conscious, any increase in the depth of the cannula, the patient will respond and tell you that it hurts, and then that's your biofeedback. So it's extremely safe to do it under tumescent anesthetic. Liposuction is not a treatment for cellulite, and the final specific risk to radiofrequency assisted liposuction, or for liposuction for that matter, is deeper structures being inadvertently damaged, either temporarily or permanently. And these could be nerves, muscle, and in the majority of the cases, all the surgery is happening between the underside of the skin and top of the muscle where the fat resides, and there generally are no major nerves in these areas. There are a few specific areas, such as when we're doing chin liposuction, there is the marginal mandibular. Once again, it's deeper than where we are, but it is important to ask your doctor about nerve injuries, vessel injuries, muscle injuries, and injuries to deeper organs. So those are specific to BodyTite or neck-tite liposuction, the class of liposuction which is radiofrequency assisted liposuction. In the next video, I will deal with the risks and complications common to all surgical procedures. If you are affected by any of this and have more questions, do feel to comment on the box below.